Hi, I'm Jeffrey Berg. I'm an orthopedic surgeon at Town Center Orthopedics. I've been here for 26 years, and I specialize in sports medicine with a concentration in shoulder, elbow, and knee surgery. Traumatic shoulder instability often occurs in sporting activities or after falls. Common injuries are, for instance, in the case of a football player tackling someone, or a wrestler getting their arm torqued, or sometimes somebody grabbing something overhead and falling forward. So there are two types of instability primarily. There's non-traumatic shoulder instability and traumatic shoulder instability. Non-traumatic shoulder instability typically occurs in people who are naturally loose jointed, and traumatic shoulder instability occurs after some kind of injury to the shoulder. When the shoulder experiences a traumatic instability episode, it can be quite significant. These patients sometimes have significant pain. If the shoulder is dislocated, in which it comes out of the joint, they can have deformity and the inability to use their shoulder. If it just partially comes out of the joint, they may have initially some stiffness, but either way, they usually develop stiffness, weakness, and limited range of motion. So usually when somebody has a shoulder instability episode, they know it. They can feel the joint slip out of the joint. And so if you have this kind of experience, but you really still can move your shoulder and there's no deformity, then it's okay to be treated in a non-emergent fashion, but you should see a doctor soon. If, on the other hand, you can't move your shoulder or there's gross deformity of your shoulder, you really should go to the emergency room urgently. One of the problems in shoulder instability is that the problem can recur. They can have repeated instability episodes. And this is more likely to occur in younger active people. And so, in that population, particularly if they're involved in contact sports, surgery is often recommended. In the older, less active person, sometimes non operative treatment can be used. And that may consist of initially a sling, followed by physical therapy and rehabilitation. So, depending on the type of treatment that you have, obviously the recovery process will be different. If you have non operative treatment, usually we start with a sling for a period of time to rest it and allow for comfort. And then there's rehabilitation with physical therapy and a slow progression back to activities. If the person has surgery, they're typically in a sling for about 4 to 6 weeks. And then there's a lengthy period of physical therapy that may extend for several months. Typically, in these patients, they're not returning back to their sports for at least 6 months and usually 9 months. When a person has shoulder instability, they're at risk of recurrent shoulder instability. And every time they have another episode, they may do further damage to their shoulder. This may include damage to the cartilage, but of particular concern is damage to the bone. And with each shoulder instability episode, the bone may get diminished in both the cup side and the ball side. And this then can lead to even more often shoulder instability episodes. And not only can it affect your quality of life, but the surgical procedure to correct that can be more complicated and involved.